In this lesson, we will talk about creating and using checklists for field data collection in community health nursing. Checklists are essential, evidence-based tools that enable nurses to systematically gather, standardize, and improve the quality of data during community health assessments. Their thoughtful design, implementation, and adaptation to local context are critical for effective fieldwork and meaningful health outcomes. In community health nursing, checklists are tailored tools used to streamline data collection for various purposes. For example, windshield surveys provide an overview of community needs by assessing housing, public spaces, and health services. Environmental health checklists identify risks like pollution, sanitation, and food access. Household family assessments focus on family structure, chronic illness, and safety, while health screening checklists guide population health monitoring through vital signs and immunization records. Lastly, community resource inventories help map services like clinics and social organizations, identifying gaps for effective referrals. These structured tools ensure comprehensive and consistent data collection. Windshield survey: are houses well maintained? Is public transportation available? Environmental health: are there visible signs of pollution? Are waste disposal systems adequate? Household assessment: who lives in the household? Is the home environment safe for children? Health screening: has the individual received all age-appropriate immunizations? Resource inventory: list all primary care clinics in the area. Are there accessible mental health services? Effective checklists in community health nursing are built on key principles to ensure usability and reliability. Clarity and specificity are crucial, using clear language like "check for safe drinking water," rather than vague terms. Items should follow a logical sequence, aligning with workflows, e.g. Demographic: fifth, environmental funtwine clinical. Brevity is essential, with concise items grouped into sections to avoid overwhelm. Checklists must also prioritize usability with readable fonts, clear headings, and adaptability for field conditions. Lastly, a user-centered approach involves nurses in the design, revision, and pilot testing to ensure practicality and effectiveness. Creating and implementing effective checklists involves several key steps. Start with a needs assessment to define goals and gather input from the community on local priorities. Ensure stakeholder involvement by collaborating with community members and interdisciplinary teams for inclusivity. During drafting, create clear, measurable items using standardized language. Pilot the checklist in a small setting to gather feedback. Then revise for clarity, cultural relevance, and completeness. Provide training for nurses through demonstrations and practice, offering ongoing support. Finally, integrate the checklist into interviews, observations, and home visits, adapting it to complement other tools as necessary. To ensure cultural sensitivity in checklist design, involve diverse community members to reflect local values and practices, use culturally appropriate language, and train nurses in cultural competence for respectful data collection. Regularly update checklists to adapt to changing needs. When choosing between digital and paper-based formats, consider resources, staff comfort, and community context. Digital checklists offer real-time data integration but require tech training and connectivity, while paper-based options are low-tech and adaptable but less efficient. Provide thorough training, especially when transitioning to digital tools. Evidence-based checklists offer several advantages, including reducing errors and standardizing data collection, improving efficiency, enhancing inter-rater reliability, and supporting quality improvement through better documentation and regulatory compliance. However, limitations include the risk of checklist fatigue, over-reliance that may overlook nuanced information, potential cultural bias if not adapted, and inconsistent use that can affect data quality. Balancing these factors is essential to maximize their effectiveness while minimizing drawbacks. Checklists, questionnaires, observational guides, and interview guides each offer unique strengths and limitations in data collection. Checklists ensure standardization, efficiency, and reliability, but may risk fatigue, bias, or missing nuanced data. Questionnaires are adaptable and gather both quantitative and qualitative data, but may suffer from incomplete responses and lack standardization. Observational guides provide rich contextual insights but require more training and lack uniformity. Interview guides offer depth and adaptability, but are time-intensive and prone to interviewer bias. For nurses, combining these tools ensures comprehensive, culturally sensitive, and systematic data collection, supported by regular training, stakeholder engagement, and periodic updates to reflect evolving needs. To sum up, checklists are indispensable for reliable, efficient, and standardized data collection in community health nursing. Their effectiveness depends on thoughtful design, cultural adaptation, and integration with other data collection methods, ongoing training in the field.